Hello everybody, can I extend a very warm welcome to you all to Behaviour Change Training's first ever webinar. My name's Karan Thomas and I'm going to be your host for the next 30 minutes, where we're going to be looking at applying a behavioural approach to a virtual world. Now, I'm a public health facilitator and trainer with Behaviour Change Training, and I train on level 1 and level 2, but also on the group work skills. Now, you'll know because of COVID-19, that's not a lot of group work going on at the moment. Now, prior to that, prior to COVID, some of you may already have been working virtually, but since then, we're all being asked to work virtually, and nearly all clinics are now being run from our home. So what we thought we'd do at Behaviour Change Training is really just take a step back and think about how we can still be effective when we're working behaviourally, and yet we are working remotely. There's 3 things we're going to be covering in our 30 minutes. We're going to be reminding ourselves of what a behavioural approach is versus a traditional approach. That's just to make sure we have that at the forefront of our mind. We're going to be looking at those skills that we use behaviourally and how they can be used effectively within the virtual clinic, and then some extra considerations or hints and tips. Now, I'm delighted to be joined actually in this webinar by 3 dietitians who have experience of working virtually already. There's Sam, who's working with patients with complex health and social needs, either through brain or spinal injury. There's Linda, who works mainly with clients with gut problems and food intolerances. And there's Cheryl, who works in mental health with young people with eating disorders. So can I just start by asking Sam to kick us off, really, and just to say, Sam, from your experience, how's this virtual world been? Because you had some experience before COVID-19.
Yeah, I did have some experience before, but I think I was actually quite nervous about making the shift to the completely virtual world, particularly with some of my patients in the community. But so far, I've been really pleasantly surprised with how they've embraced the changes, embraced the technology and our different way of working. And so far, it's worked quite well for me too. I've been able to offer more regular appointments because they're slightly shorter, and I'm not having to allow the extra time for travel. So it's a bit of a win-win at the moment for us.
So you've actually found that there's been a lot more positive things despite your nervousness at the beginning. Linda, can I ask for your experiences, how's it been for you?
Well, again, very similar to Sam. We'd been working this way for a good couple of years before COVID-19. So actually, I'd got experience in a good use of technology. We'd got some technology. We particularly use a platform called Doxy.me. I think the one big thing is always reassuring patients that, everything's secure and we're not going to be hacked, that sort of thing. Most of the consultation is still very much the same, surprisingly, and it's nerve-wracking, and there's many little things that you get used to. The worst bit, seeing yourself on screen, but yeah, you get there, and I am enjoying it.
Oh, that's lovely. So there's still security and confidentiality issues, so we'll maybe have a talk about some of those. Cheryl, can I ask what your experience has been so far?
I found it works very well with patients, and most people are very happy to use it. We do always just check with people that is okay, and they wouldn't prefer a telephone consultation because some people perhaps are a bit self-conscious, or they don't have the technology. In the NHS in our area, we use an app called Attend Anywhere, which actually works really well because it makes appointments for people. And when they log in, it puts them in a waiting room, and then we just pick them up from the waiting room. So, it makes it very easy at the beginning.
So the technology is trying to almost replicate what, the kind of face-to-face experience would be. Can we just take what Sam, Linda and Cheryl has said and really kind of begin to have a look at, what might be the same and what might be different? As they've said, there's now a virtual meet and greet of a client. As Cheryl was saying, there's the waiting room. But what there isn't is there's no walking to the, from the waiting room to the consulting room. And that's often what we used in order to begin to build rapport with our patients and establish that helping relationship. Also, we mentioned that we're actually stepping into the patient's environment, and Cheryl mentioned that patients might not be comfortable with this because you get to see their home. And again, there might be issues around that. So providing options via the telephone is often good practice. Lynda, you mentioned IT glitches and things, and they're legendary, aren't they? From people ringing the doorbell to the dog barking or whatever it might be, or no sound, or the internet going down, whatever that might be. So again, it's taking those into consideration, really. There's also, we may not be able to take measurements or, see any paperwork that the client has prepared. So, looking at ways to overcome that. We mentioned about distractions there. Some people might be nervous. We might be nervous. They might be very nervous. And so the importance of helping settle people down is at the forefront of our minds. And also, when we're thinking about the screen, there's actually limited body language. So we can pick up limited things and they can pick up limited things for us. So we have to look at making the most of this, the upper part of our body and our face, really, in terms of expressions. Let's have a think about what's exactly the same. And this is the work of Moira Stewart in her book Transforming, the Clinical Method of Patient-Centered Approach. And the reference will be at the end, so you can pick that up if any of you want to explore it further. But patients still want to be heard and understood. That's their expectation. They come along to a consultation wanting to tell their story. And so it's for us really to look at how we can use our communication skills to make sure that they get what they're looking for. But they want and still need our expert information. So how can we give that in a way that they can listen to and understand? Yeah. So what I'd like to do now is just to take a couple of minutes of your time really to just explore what we mean by a behavioural approach and how, that is different from maybe our traditional way of working. So we know that a behavioural approach, and very simply, is client-centred. That can be quite jargony. What do we mean by that? But it is directive. And those things can seem as if they're mutually exclusive, and yet they're not. Because if patients' expectation is that they're going to be heard and understood, then we need to be thinking about building a collaborative relationship, one in which their experiences are valued, and we work hard to show that we're actually listening to them and getting an understanding of what the disease state or the issue may be like for them on a day-to-day basis. But it is directive in that we are becoming facilitators. We're helping a client think about what's the best possible outcome for them, and then working to allow them an insight and us an insight into how they can best get there. If we think about how that differs from our traditional approach, then and many of you will feel the same about this. We've often felt with good intentions that we want to fix the patient's problem. And we might find ourselves slipping into giving advice. Why don't you try? You to eat off a smaller plate, or to go off the bus and stop earlier. We can give information. Do you know that this is the latest research, Or we can try direct persuasion, oh, you'll feel much better, you'll have more energy. Whatever that might be, what we know, if we slip into this way of working and we come up with all the solutions, is that puts the patient in a passive role to our expert knowledge and really doesn't engage them. So it's not a collaborative way of working. And you'll often hear patients, if we know we've gone into this mode inadvertently, you'll hear patients say yes but that wouldn't work for me because, or no, that would, and that means that maybe we've slipped into trying to fix it. So we're really looking to use all of our listening skills, our reflection, our paraphrasing, to think about helping them get an insight and us get an insight, working together in order to get to the solution that's best for both. Just a little bit about the virtual consultation. As we said, so many things are exactly the same. Consultation has a beginning, it has a middle, and it has an end. Now, for the purposes of this webinar, we're going to focus on the beginning and the end. And, you might want to look out for, we might do another one, which looks at the middle. So if we're thinking about the beginning, we're talking about preparing, right? So what do our proper preparations need to be? And how do we meet and greet? In the middle, we're looking at capturing the overall picture, getting the patient to talk, getting a real picture of what the disease or the issues and how it affects them, and then exploring options for change that are realistic, developing a plan. And then we're coming to ending the interview. So as we mentioned, for the purposes of the webinar, we're going to be looking at the beginning and the end. So can I bring our dietitians back in here and say, for your preparations, can I just ask maybe Sam first, what kind of things are at the forefront of your mind when you're thinking about preparing for this virtual consultation?
Thanks, Karen. Well, for me, working virtually has really emphasised the importance of good preparation. And I find with a virtual consultation, there's more work in the preparation phase than perhaps with a face-to-face appointment. And that preparation starts really from the very first contact you have with the patient, which might be via a telephone call or it might be an email. And I'm fortunate in my private practice that I can send a lot of information in advance to try and prepare the patient as best I can, as well as preparing myself. So we will send information about the process, so how to use the IT software. We'll send information about ourselves and our service, and we will also send some forms and things ahead of time as well. And then on the actual day or time of the appointment, just allowing yourself a little bit of time to prepare, looking at what you're wearing. Is it appropriate? What does it look like on the screen? Looking at what's behind you. Is that distracting in any way? So really just trying to look professional and feel professional and prepared for our patients.
Wonderful. So you mentioned there that you're looking at the very first contact a patient has, often through written. It's either an appointment letter, isn't it? And you can actually do quite a bit of work within that, keeping it nice and simple, obviously, but looking at preparing them so that they know what they're going to be expecting. That's great.
Absolutely.
Yeah. Cheryl, can I ask you, what about your prep for your patients?
Well, again, like Sam said, but we would also make quite sure that we had read through any referral letter or checked through any medical notes well beforehand. So, you know, you've looked at all those things about the patient first. Maybe if you need to check anything like blood tests or whatever, make sure you've looked at those. If you need to contact anybody else in your team or find out, you know, anything more, then make sure you've done that to begin with before you have your virtual consultation. Because it's very difficult actually in the virtual situation to look at notes and things. Often you can't get them on the screen at the same time, or you know, you want to be holding you want to be looking at your patient, don't you? So
yeah. So you're both talking really there about anything that detracts from the consultation itself, really, and as much preparation that's done as possible. Let's just have a wee look at some of the things that we can talk about. We mentioned written information there, and again, wherever we can, it might also be that, you know, we have a telephone call just to check. That sometimes is, you know, easier for a person. We can start to build a relationship there just to check that they know what to expect, they know how to work things, and we can help by, you know, coaching them along with some of the technology too. We mentioned too, and I think Sam, you mentioned about the room and the environment, because it is, you know, what you have can actually be distracting on the screen. Just look at what you look like, look at what you're wearing, and make sure that comes across. Are you too far away? Are you too near? So whatever preparations you need to do, and as Cheryl was mentioning there, very much about, you know, what about the notes, or there's anybody else in the team, or the blood test results, or anything else, that they have that all prepped beforehand, just as we would within our face-to-face clinics, really. So whatever's relevant for you. Can I now come on to the first contact, really? And on our level 1 courses, we spend a lot of time looking at why this is so important and then how to do it. So I'm just thinking, you know, sort of, Cheryl, when you're meeting and greeting people for the first time, what's in your mind? What do you think is really important? And do you have a wee checklist that you might go through? Whatever?
I think it's to remember that those first impressions are so important. So when they first see you on the screen, really to remember that. So, you know, have a pleasant smile. You know, again, ask people how they are. Do a little bit of small talk as you would if you were seeing them face to face, and check they're comfortable. I always check if they want to fetch a pen and paper, or, you know, a glass of water or whatever. So they've got all that in place to begin with and feel comfortable about then going into the consultation. And we would then do similarly as we do. We would have a nice opening phrase, you know, something like, "I've received a referral letter from your doctor. Perhaps you'd like to tell me in your own words what led up to our appointment together today."
Mm-hmm. Lovely. And then if Lynda, what would you be holding in your head really around meeting and greeting? What's important for you?
Well, it's very similar to when you meet somebody face to face, always checking that you've got the right person in front of you, introducing me so as they know it's me. Checking the contact details is very important, especially virtually. I mean, at the moment, where would we be if we didn't have Wi-Fi? But it can go wrong and we can have glitches. So it's important to be able to get in contact with them again should something happen, you know, so phone numbers, emails, making sure that all of that's okay. And also just clarifying again, I think the time you've got available, it may be the only thing they've got on that day, and therefore they're quite happy to sit and chat for an hour or an hour and a half, but we probably haven't got that luxury. And so it just helps to reinforce and to check that they're still okay to talk for 30 minutes or whatever. It just to sort of bring it all together, that's still very important.
Thanks both. So let's go through this in detail then. So if we're thinking about meeting and greeting, the function of meeting and greeting is to establish the relationship, to begin to build rapport. Now, we're welcome and we're greeting and we're introducing ourselves and we're smiling. And we talk about this being a golden moment, don't we? Humans, when they meet somebody for the first time, are doing such a lot of absorbing what you're saying, how you are, and most of it is focused on our face. And if we smile, then we're saying we're friendly. This is okay. This is going to be all right. The importance of helping reduce the nervousness and including some small talk. You know, and it could be about anything, couldn't it? So, but just having that couple or that minute or the 30 seconds just to say, how are you? How are things? We mentioned then about maybe reintroducing ourselves, saying our name again, checking the patient's details, as Lynda said, and also the name that they prefer to be called. We do talk a lot about the fact that on your written notes, you may have somebody's formal name. That might not be the name that they are known every day. And so it's always nice to say, you know, if it says Mary on here, you know, is it okay if I call you that, or would you prefer to be called something else? So that it's just checking that we're getting the right name and the right person there. Lynda also mentioned, and Cheryl did too, about checking the time is okay. And this is vital, really. And when we're going to be looking at how we end the consultation, we'll see that just checking that, you know, we have an hour today or we have half an hour today, are you okay for that time, is really showing respect and valuing the person's time, really, so that you can manage the time within the session that you have. There might be other relevant details, there might be test results, there might be letters that we need to look at, or there might be payment. And then Cheryl mentioned the opening phrase. There has to be, if we begin to tease this apart, a time when we move from, you know, the kind of just making sure we've got everything in place, the smile, the welcome, the names, the time, when we actually start to talk about the issue that the person's there to see you about. And Cheryl mentioned, you know, something like, you know, I've had a referral, or you've agreed to see me at this, it's led up to that. And that is the first part of allowing the person to tell the story and how they see it. And that's so useful for you both to get an understanding of where they see themselves and why they see themselves there, and then the referral letter or whichever that you've got there. So that's lovely. Thank you for that, Bo. If we move on now to the middle, now as we mentioned within our webinar today, we're not going to be talking too much about the middle because it's a whole webinar in itself. But in the middle, we're trying to capture that overall picture. So again, we're using all of our communication skills, our opening questions, or our open questions rather. We're checking that the information that they've got and they're checking their understanding, and we're exploring options for change, but we're focusing all the time back and back on what the client wants to, the best possible outcome for the client, making sure that that is there. So within that, I'm now just going to skip straight to the end of the consultation and how we bring that virtual consultation to a close. So I'd like to, can I bring Lynda in here? Lynda, would you just mind mentioning, a little bit about your experiences of closing the consultation?
Thanks, Karen. I mean, closing a consultation was something I always struggled with when first starting out as a dietitian. I found it really hard to tell somebody they'd got to the end of their time, and I struggled to develop techniques and phrases and that sort of thing, but I've got used to it. Some of it we use with body language, but one of the main skills which comes that I use face-to-face and virtually is time. And therefore, I think it's really important for me to reassess, to say we've got about 30 minutes. In private practice, I'm lucky I allow an hour. And then as we're getting towards the end, I might say something like, I've only got we've got about 10 minutes left. And if I know I've got time to go on, I might add, if you're happy to go past that, we can do something else. But otherwise, I might say, we've just sort of got 10 minutes left. We've covered most things. And sort of bring it that way. Then when you get to the 10 minutes coming up, it's much easier to say, we've sort of reached the end of our time today, and finish it that way. It comes with practice, but it's setting the scene at the start to be able to do it at the end, I found is a key for me.
So Lynda, so that's, as you mentioned there, the importance of mentioning time at the very beginning, and you mentioned that you didn't really know how to do that at the start. You may be standing up and just giving that message that this is finished now.
You can't do that virtually. You know what you do, just duck down and it's gone. Click.
And yet it is so important, because what the patient is going to be thinking about when they leave you is going to be encapsulated in the final few minutes of your consultation. And signposting, as you mentioned, that it's coming up. So we're coming towards the end. And then, as you say, you might have the luxury of being able to say, are you okay to still talk for another 10 minutes, or shall we bring it to a close now, or we can make another appointment? So there are options there. Cheryl, can I just ask you about closing the consultation? What's the important bits that you hold in your head?
Thank you, Karen. I think it's about being very clear about what's going to happen next after that appointment. So are you going to be making another appointment to see the patient, or perhaps they're going to see somebody else in the team? Who's going to make that appointment? When's it going to be? Will it be virtual? Will it be on the telephone? But just to be very clear, so that when you finish, your patient knows exactly what's going to happen next and within what kind of time frame.
Perfect. So if we just look at what both Lynda and Cheryl have said here, it's important to start this phase on time. So that's why we mentioned it at the beginning, as we mentioned earlier. The closing sentences should be clear, and we might want to be saying, what's been the most important thing for you? If we're coming towards the end, can I just summarize a little bit about what I think we've talked about? You can tell me if I've got it right. We don't introduce a new subject, because again, then time would just run away with us, and clearly does. But as Cheryl was saying, making sure that the client understands the arrangement. So what's going to be happening from here? What is it that they're doing? And so again, our summarising skills at the end here come to the fore. Now, we've done a little bit of a whistle-stop tour through this, but this is just a few pointers to know if we're working behaviourally, if we're getting it right. Now we're speaking slowly. The pace and the tone are really nice and relaxed from both parties. If we can, the patient is doing at least 50% of the talking. We should be encouraging them to be active. If they're talking, they're working hard. Listening is the least effective way of engaging a person into it. So we need them to be doing a lot of the talking, then we're getting a good understanding of what's happening for them. We are listening very carefully and we're reflecting back and we're showing the patient that we're working hard. Can I just check that I've got that right? Sounds as if you've struggled with that for a while. There seems to be there's a lot going on for you. So helping the patient, getting an insight into what's happening for them is crucial here. The patient also might be asking for advice. Wish that they did all the time, but never mind. How would I do that? And if all of these might not pertain to your consultation, but at least getting a few of them in there, then you'll know that we're working in that kind of behavioural way. So, thank you very much, Deet, for everybody to listen. I just want to finish now by asking both Sam and Lynda and Cheryl if they had some hints and tips to improve that patient experience working virtually, what would it be? And I'm just going to ask you for one thing. If there was one thing that really made a difference to this virtual consultation and keeping it behavioural without slipping into this is what you could do, what would it be? Sam, would you like to kick off, please?
Thanks, Karen. I think I would probably go back to the preparation and really making sure that any information that you give the patient prior to the appointment is in a behavioural way. So thinking about the way that we're speaking to people on the telephone, the wording in emails, any written information, and making sure that we ourselves are prepared and giving our patients all of our time really when we see them.
Yeah, so it's almost like helping the patient get the best out of this virtual consultation, isn't it? Growing them into it just as much as growing us into it. Thanks. Lynda, what about for you? What would be your top tip?
It sort of falls on a little bit from what Sam finished there. My top tip is probably to try and stay in the moment and to be present with your patient. And I think we all do that naturally when we're face to face, but in a virtual world, we've got so many other things going on. We might be seeing them on a laptop, but at the same time, we've maybe got a mobile phone next to us. We've maybe got an iPad or another tablet somewhere else, all showing us different things. And it's so easy to, especially if you're doing it on a phone and you can move about, to pick something up and to walk around and to start making a cup of tea. And you can do that on the phone when somebody can't see you. But so with all of these, stay in the moment and stay present, just as if you were sat in your clinic room with your client.
Absolutely. So there are a myriad of distractions, both for the patient and for us working at home. It's not a normal environment, if you like. And so make it even more important to give the patient your full attention and be mindful of that. And lastly, Cheryl, what would be your top tip?
My top tip would be remember those non-verbal skills, because the patient is focused on you even though it's virtual. So remember to smile, remember to make good eye contact with them, and remember the expressions on your face really when you're talking, because they'll be looking at you.
Yeah, they will. That's lovely. Can I just have a wee roundup of that? So thank you, the three of you, really. So we've got practice with the technology, because that can get in the way, can't it, terribly. Be aware of how we're dressed and the video screen picture. And then, as Cheryl was saying, I think really remember and think about our non-verbals. Yeah, what's our face saying? What's our expression saying? How's our voice sounding? What's the pace like? What's our tone like? And all of that is really important to build rapport, right? And that's what all of this is about. We can have the best clinical brain in the world, but if we can't engage with our patients, then it doesn't matter how good we are, they'll not listen to us. And it's a truth borne out that if we listen to people, they will listen to us. So helping the client settle, making the small talk, checking their details, talking about the time available, all respectful, talking about contingencies if things fail. Those communication skills, we make no apology, are the main elements, however small, that really build a collaborative relationship. I'd like to say, just, from all four of us, thank you for listening in to us, really. It's been such a pleasure to do this. We would love your feedback too. And if you click on that link below, the SurveyMonkey link, and if you're able to provide us with your name and address, then we'll send you a copy of these slides, a certificate of attendance, and a reflective activity for your CPD portfolio. So thank you again. We hope that it's been useful, and like any other learning opportunity, we hope you just take away what works for you in your situation. But at the end of the day, if there's distance between us, it's still focuses on us working behaviourally with our patient and client, and there's a lot of benefits to it as well, as we've seen. Thank you for your time.